Hey there, I am Valerie Cornell Caloran, Group 4 from the Esmona F of Polytechnic State University of Bicol. And today I'm going to do marathon demonstrations on preparing oral medications and administering oral medications. For the first step, we need first to assess the patient. So we need to assess the patient if the patient has these allergies to the medications and also the ability to swallow the medications, and also if there is a presence of vomiting or diarrhea that will interfere with ability to absorb the medications, and also a specific drug actions, side effects, interactions, and also the adverse reactions. And the other one is the client's knowledge and learning needs about the medications. So we need to explain further about the given the medications and also perform appropriate assessment that like the taking vital signs, right? And then we need to determine if the data influence administration of the medication, if it's appropriate to administer the medication, or does the medications need to be held in the prescribers notified. Alright, so for the preparation of our equipment, so the supplies that we're going to use, of course, do not forget the MAR. We're going to check the informations on the medications along with the MAR, and also our dispensing system. Let's assume that this one is our dispensing system, and the other one is our medication cups. It can be disposable or a plastic cups like here, and our tablets, of course, here, tablets, and also for the pill crusher if the patient cannot drink or cannot take the solid medications or a tablet, so we're going to crush that. And also the straw for to avoid any discolorations of their teeth, and syringe, and also the liquid medications right here. And for the soft food such as pudding or crush medications, if the patient refer to that, so we can give to the patient. And also the drinking water, the commonly is the water, but the patient, if the patient wants the juice, then we can give a juice to them. Okay, so for the procedure, we need first to perform hand hygiene, hand washing, and observe another appropriate infection prevention procedure. So sanitizing, and then since I have cuts on my fingers, then I can do the donning of gloves. And unlock dispensing system. So let's assume that this one is our dispensing system. For the next procedure is we need to obtain the appropriate medications right here. Then we're going to read the MAR and take appropriate medication from the shelf or the drawer, or it can be in the refrigerator. The medication may be dispensed in a bottle, box, or a unit dose package. So we need to compare the label of the medication container or unit dose package against the order on the MAR or the computer printout. So here, it should be paracetamol, and the brand name is Ultramol. Here, so it's paracetamol. Alright, and then we're going to check the expiration date of the medication. So manufactured last 5/2020 and expiration date is 4/2024. Alright, so that is not expired. So if in case that the medication is expired, then return the expired medications to the pharmacy, and use only medications that have clear legible labels. So it has these legible labels, so I can read it clearly. It's paracetamol. And then next is we're going to prepare the medication and calculate the medication dosage accurately. It should be 500 milligram. So, alright, it is 500 milligram. Okay. So, as we already prepared the correct amount of medication for the required dose, so without contaminating the medications, alright. And then while preparing the medications, so we're going to recheck it again using the MAR with this tablets or a container. Alright, so if the medication is tablet or capsules, so we're going to place the package unit dose capsules or a tablets directly into the medicine cup. So as the record, this needs only one 500 milligram tablet. So I'm going to cut it. Alright, just one 500 milligram. Okay, and then we're not going to remove the medication from the package until we already went to the patient's room. Right. Then we're going to put it here on our medication cap. And then if using a stock container, we're just going to pour the required number into the bottle cap and then transfer the medication again into the disposable cup without touching the tablet. So for example, I'm going to demo it. So just pour the tablet by not touching the medication, and then put it on the medication cup and then close it again. Give narcotics and medications that require specific assessment, such as pulse measurement, respiratory rate or depth, or even blood pressure. And if it is cord tablets, so break only tablets if necessary to obtain the correct dosage, and use a cutting or splitting device to cut the cord tablet. And also check the agency policy how to unuse portions if the medications are to be discarded. So if it's already cut, then check the agency policies how it can be unused. And then if the patient cannot take the tablets or solid medications, then it can be crushed. So crush the tablets to a fine powder, then mix it on the powder in a small amount sa pagkain ng ating patient. And then check with the pharmacy before crushing the tablets. So check for the pharmacy before crushing the tablets to sustain action. Enteric-coated Bucan or sublingual tablets should not be crushed. Alright, and next is for our liquid medications. So for example, so this one set aside here. For our liquid medications, so thoroughly mix the medications before pouring. So mix it. Alright. And then, after mixing it, so discard any medication that has changed color or turned cloudy. Yan. So let's assume that already this one is visible. So it is not, it has the right color and not cloudy. Then, remove the cup and place it upside down on the countertop to avoid another cross-contamination. So remove the cup, then place it like this under. Alright, then hold the bottle so the label is next to your palm. Okay, so let's assume that this one doesn't have the label, so the label should be on our palm. So if in case not the medication is leaked, then there's no possibility that it can wash out the labels. Alright, okay, to hold the bottle so the label next to your palm. Then place the medication cup on a flat surface. Here, it is already flat surface. And then, fill it to the desired level. So, 5 ml to this desired level using the bottom of the meniscus. So, yung meniscus, this one is a crossing shape, upper surface of a column. Okay, so before pouring it should be on the eye level. So, let's adjust. 5 ml. Alright, the labels on our palm, then 5 ml. Then pour it. And then before closing the cup, we need to wipe the excess medication. And then dispose this one. Okay. Then close it. Alright, so when giving a small amount of liquids like less than 5 ml, we're going to prepare the medication on a sterile syringe. So I have here the sterile syringe, so without the needle. Alright, then get it. As we're going to transfer get the 3 ml using this sterile syringe without the needle. Alright, then get another medicine cup. Okay. Then going to get it now 3 ml. Okay, it's 3 ml. Then label the syringe with the name of the medication and the route or the DO. Okay, then transfer it. Then, we already did the demonstration. So, we have here the liquids, and I have here the 3 ml, and I have here also the tablet. But the medications that I'm going to give to the patient is just this paracetamol. And then, keep unit dose liquids in their package and open them at the bedside. Okay, next one is we already prepared the medication. So next is place the prepared medication along with the MAR on the medication cart. But I have here the medication tray. So just put it here. And then we're going to recheck the label on the container before returning this on the storage place. Alright. So let's check. Paracetamol 200 milligram. Alright, then only one. 200 milligram, okay. Alright, then I already checked it. Alright. And then, do not forget or do not leave the prepared medications unattended. Alright. The next is lock the medication cart before entering the client's room. So, lock. Then, lock it. Okay, so after preparing all of the medications, so we are now ready to go to the patient. And before doing that, we're going to observe another hand hygiene. So, remove the gloves. Alright. Okay. And then, do the hand washing and sanitizing. And let's go to the patient. Next one is to check the number. Okay. So next one is check the room number against the MAR. If the agency policy does not allow the MAR to be removed along with the medication card. Okay. So my patient's number is 0089. So the patient, okay. So it is the right room for my patient. Hi ma'am! Hi po. Good day po. Hello, for the first procedure is we need to provide for the client's privacy by closing the doors once we enter the patient's room and also closing the windows. And in the ward, draping or close the draping. Alright? Okay. So next is introduce myself to the patient and verify the client's identity. Alright? So hi ma'am, I am Rita Duran, your student nurse for today. Okay, so for verification only, can you please state your surname, your first name and your middle name along with your age and your birthday po. Okay ma'am, can you please state this po?
Vallejo Shaira Bagaporo,
Okay,
18 years old.
alright, and then birthday po.
April
Okay, 2005 po. Alright. Okay, it seems that the MAR and the record on your wrist match. Okay, so you are my patient. Okay. Next, ma'am, is I'm going to put you in a sitting position po. Alright, so can you do the sitting position po or just a sideline position po? You can sit po. Okay, so I'm going to assist you po. Okay. Alright. You can move po. Okay, so for our next procedure is explaining the purpose of the medication and also how it will help using the language that the patient can understand. Alright, ma'am, so when explaining po the medications, what kind of language do you prefer po ba? Is it Tagalog, English, Rinconada, or Rinconada?
Tagalog po.
Okay, so Tagalog na lang po. So, i-explain ko po ang medications, no? So, sa record po, meron ka po which is above normal po sa ating normal temperature. At meron ka din pong headaches, no? Ayan. So, dahil po sa flu, nagkakaroon ka po ng fever. Okay, so, we are going to administer po a medication which is paracetamol po. Check in the MAR if it's the correct medication. So, paracetamol po, 500 mg. Ayan. So, brand name po, Ultramol. Okay. It is analgesic and antipyretic po. Opo, meaning po, it can reduce the pain po, and also it can relieve the pain rather, and it can reduce po the fever, bababain po natin yung temperature mo by taking these meds po. Alright, so for the side effects po, kung natataka kayo kung anong side effects ng paracetamol, since it doesn't have any common side effects, no? So, kapag nakaranas po kayo ng kahit anong pain at nadagdagan yung sakit ng ulo nyo, so please sabihin niyo po sa akin, no? So, at lalo na yung mga rashes kasi bihira po magka-side effects ng ganito po. Okay, so wala naman po ba kayong any reactions kapag nag-take po ng paracetamol?
Wala na.
Alright, so wala naman po. So, for assessment lang po, no? You can take orally, you can take medicines orally po, no? So, you can swallow a tablet. Okay. So, nakatake ka din po ng paracetamol before?
Yes. Ilang
Alright.
beses na.
Okay. And then, bago po tayo mag-take ng meds po, so, I'm going to check for your vital signs muna po, alright? Your pulse rate muna po. Okay? So, can I touch you po? Okay, for 1 minute. Okay, so let's assume that it's already 1 minute. Okay, so it seems that your pulse rate naman po is normal. Okay, next one po, ma'am, is your blood pressure po, Okay, ma'am, so it is 110/80 po, no? So, normal naman po. Administer the medication in the correct time. So, ibibigay ko po, ma'am, yung medications mo every 6 hours po, no? So, 7 a.m. po. So, right now po, it's already 6:58. So, next is take the medication or take the medication to the client according to the guidelines of the agency. So, the guidelines of the agency is putting the medications on the packaging. So, since I already enter into the patient's room, then I can remove the packaging of the paracetamol. Alright? So, next one, ma'am. I'm going to ask you po, no? So, before taking these medications po, ano po prefer nyo? Is it juice po ba or a water po?
Water.
Water, okay. So, if the patient wants a juice, so we need to check for the food or if it's for the incapabilities of our medication prior to taking the juices. Alright? And then, ma'am, so you can hold the po ba yung pill using this one. Alright, so if our older client or adult client cannot hold the pill cup, then we can assist the patient in holding the pill cup. Alright, and also ma'am, kapag hindi niyo po kayang iswallow yung medication, no? So, bago ka po mag-take ng water, so ang gagawin niyo po is, pwede niyo pong yung medications or tablets, ilagay niyo po sa ilalim ng tango niyo, okay? So, para ma-avoid natin na anumang aspiration, alright? So, bago mag-take ng water, kung hindi po kayong iswallow, pwede ilagay sa ilalim ng tango niyo, okay? So, if the medication has the objectionable taste, then ask for the client to have a few ice chips or a puddings or juices if there is any contradictions. Alright, ma'am? So, if it has taste po, no, na hindi nyo magustuhan, you can ask me some few ice chips, no, and juices po, no? So, since nakatake naman na po kayo ng paracetamol, so try nyo po bang inumin ito kahit na lasang mapait, ganyan? Alright? So, alright, magte-take na po tayo ng paracetamol, okay? So, next, remove the packaging. Alright. Then, straw. So, you can hold the pill po, pill cup. Okay. Yung mga instructions po kapag hindi mo kaya swallow card, you can take it po. If the patient says that the medications that you are about to give is different from what the client has been receiving, do not give the medication without first checking the original order. Okay, so stay with the client up until all of the medications have been swallowed. Okay, okay na po ba, ma'am? Alright. So, after 6 hours, ma'am, no? So, 7 a.m. po tayo nag-administer ng medication. So, after 6 hours po, babalik ako, no? So, i-assess ko po ulit ang vital signs nyo kung bumaba na po ba ang temperature nyo, alright? Okay? So, do you want me to put you in a right position po, like yung kanina po? Or sitting position lang? Yung nakahiga?
Nakahiga.
Okay. So, ako na po babalik. So, ma'am. So, take care about equipment. Then, take a rest po, ma'am, no? Mabalik na lang po ako, ma'am. Then, after you go out to the patient's room, do not forget to close the doors for the privacy of the patient. Going to document each medication given. So, I'll record the medication given, the dosage, time, and complaints or assessment of the client, and also my signature. And if the medication was refused or omitted, also record this and the reason why the patient refused that medication, and also the nursing actions according to the agency policy. All right. So, we already record all of the medication given. Right. And then, do not forget to dispose of all supplies appropriately. So, replenish our medication cup here. And then, return the card into the appropriate place. Right. Appropriate place. And then also discard the use of disposable supplies like this one, our syringe, our tissues,